Good morning.
Good morning.
Hi. So today, this is Dr. Thomas Kincheloe. He is currently in residency at MSU, and I thought I'd bring him along for this AFDMA journey to let our membership know, and anybody else who's interested, who Thomas is, who Dr. Kincheloe is, and a little bit more information about him and FDM. So Dr. Kincheloe, why don't you tell us a little bit about yourself?
So a little bit about myself is I'm currently a third year osteopathic neuromusculoskeletal medicine resident at Michigan State University in the East Lansing campus. My interests are in manipulation, particularly in how it corrects pain and also function. What kind of brought me into the FDM world was in medical school at Pacific Northwest University.
Mm.
Um, I I was intrigued with some of the other students that demonstrated some of these techniques with FDM and the model itself on myself in certain situations. And I got more and more intrigued, took one module and started finding more and more distortions as I progressed. And I just started looking for more and more opportunities to use it. And that's where my interest in FDM started.
Okay, that's great. Has MSU been pretty welcoming about FDM?
Yes, it actually has been. Numerous times throughout the clinic, I have been asked to come alongside one of the other either residents or even some of the attendings here that are looking at how can I look at their same exact patient from an FDM perspective. They're probably about 20 to 30% of my patient base are consults from others just for a quick consult that I then return back to them, specifically for FDM.
Nice. And rumor has it that MSU is a pretty big research university.
Yes, as one of the Big Ten universities, it has a very strong research base. In addition to that, part of ACGME requirements, residents are required to have some sort of research project under us. So, under the guidance of one of our faculty members, Dr. Nicodemus, who is a wonderful researcher and well known through the biomechanical universe. He helps guide us in creating projects and thinking in a research perspective. And so I've brought to him and brought about some of these topics. In addition to that, with the fund of knowledge that we have here and the numerous cases that we see here at Michigan State, we have seen a lot of cases that have been treated with FDM. So.
Nice. I'm familiar with Dr. Nick. He's a wonderful guy, very personable. He's kind of a big teddy bear, but that mind and how he works, it's great to have that access when you're needing some help and some advice for your project. So that's great. And he's been on staff now for a few years. I think I remember him leaving California and trying to figure out what he was going to do with his practice in Monterey. So it's funny how tight of a community osteopathic manipulative medicine physicians and how tight of a community we are in that respect, but also now FDM seems to be making its way through. So it's funny to hear names that are familiar from a different area to now FDM and things like that. So that's really cool. And also the P&W connection with you and Dr. Rebar is really interesting too. Did you have much exposure with Dr. Rebar back in school, or was it only during residency?
I actually did not meet up with her during residency. I met up with her during, I believe, my Module 2 course. She came down to guest teach with Dr. Capistran, and that's how I got to know her, and we've kind of kept in touch since that point.
Nice, I see. That's very cool. Interesting. Okay. So this is your third year of residency, which means you're finishing soon and headed into practice or whatever grown-up life after residency is bringing, right? So where are you headed after residency?
I am headed to Eugene, Oregon. I will be starting I will be starting as one of the physicians for a multi-specialty practice in Eugene. I will be one of 4 OMM physicians at that clinic. Um, and I plan on coordinating with a few of the medical schools that are also in the area to not only bring students in to learn more about the perspectives of OMM and how to incorporate it in their future practices, but also to help them in thinking about the research aspects, to think about how to connect what you see in clinic and how to think of the next step of how to make this scientific and even intriguing to the research community. So I'll be mentoring not only for the students that are coming through, but anyone else who really wishes to get their hands dirty with research in perspective to FDM or even OMM.
That's fantastic. It's great to hear because you hear so much out there that, oh, it's just anecdotal evidence and we're not really sure that it works. Well, there actually is research that demonstrates OMM is effective. There's good quality research, and hopefully with FDM and the way that things are headed in here stateside as well as throughout Europe, that we're going to get more and more research supporting its use. So AFDMA is very lucky to have you on board and very lucky that you're on the research committee. So it's brand new, the research committee, and you've been on it since day one, which is great. Tell us a little bit more about your role on the research committee on AFDMA and what you hope to bring in the future with that as well.
So my current role on the research committee at the AFDMA is to help with the case studies that are coming in. So we initially as a group came together to bring about not only the current case study and research contest, but we also came up with the policies, and we're also going to be judging amongst ourselves the case studies and research that are coming through. We have 2 different categories. We have the publishable category, or those that are in progress to be published. And then we also have those that have been published categories. The publishable category is going to be through a random drawing for all of those that meet the criteria that we have for publishable under one of the guidelines that we have. And then the published category is going to be more of a rigorous judging amongst the committee.
Okay, excellent.
My future plans with this research committee is to also bring forth more interest in our fellow OMM physicians, as well as us FDM physicians and practitioners, and think about what the next step, and bringing in a little bit more research regarding the science behind it. At Michigan State, we have had some preliminary discussions about radiological imaging of fascial distortions and other possible ideas of how maybe FDM is some sort of component within the endocannabinoid system. So these are thoughts that are currently in progress here, still very elementary brainstorming stages that we're looking at possible future in this.
Nice, fascinating. So that's more the basic sciences and benchmarks for things that are released during treatments. Fascinating. I didn't think of it from that level. Usually with my brain, I'm thinking more of on a clinical level and outcomes and things like that for pain effectiveness. And then of course, there's also the side of cost effectiveness as well in research. So that's really interesting to get so many different minds and different ideas working on research. And because FDM is still so young, this is a great opportunity for people to get started in research. And with you being on the research committee and willing to mentor those that are interested and give some guidance, I think that's going to be huge in the future here at AFDMA. So thank you for that. And thank you for your involvement in this committee and also AFDMA. I know I appreciate it personally. And I think AFDMA does too. I think if Dr. Topaldos was still around, he'd be thrilled in the direction that it's going. So that's fantastic. So I think that covers the topics that I wanted to cover today with you. Thank you again for your time, and hopefully we'll be seeing a lot more of you in the future.
Thank you again, and I look forward to any correspondence.